Hello, welcome to Cognitive Psychology. And I will be your lecturer again. Walang kasawa-sawa, Angela M. de Monteverde. And same reading list that we have as a reference, Robert Sternberg and Karen Sternberg, Cognitive Psychology, 6th edition. And topic number 4, this is all about consciousness. And just a brief background. Some of us may have this kind of experience that in, instead of saying para po, we keep on saying that bayad po, di ba? Or sa jeep. Or minsan naman, imbis na sabihin natin na bayad po, napapasabi tayo ng para po. Bakit nagiging ganun? And for this lesson, topic number 4, we'll answer that kind of question all about consciousness. And let's start. So, consciousness has something to do with the awareness of one's surrounding and what in one's mind at a given moment. So, kung napapansin mo ngayon na nagluluto yung mga kapatid mo habang ikaw ay nakikinig ng video lesson ko, or may nagwawalis dyan sa labas ng bakuran nyo, tumitila kang manok, umaangoy mo yung aso, or tumatahol, everything that you notice based on your perception is consciousness because you are getting aware with your surrounding. So what is consciousness? Consciousness can change very quickly when new information arrives. Meaning to say, while you're listening to this video of mine, you may notice that sinabihan ka na nanay mo at kumatok sa kwarto na, hoy, yung panty mo or yung brief mo, naiwanan mo na naman sa CR. Okay? And then, you might feel irritating for you. Kasi, ano ba, nakikinig ako sa video ng walang kakwenta-kwenta kong teacher ni Sir Jello sa cognitive, something like that. However, magdadivert yung attention mo dun sa nanay mo na binubulyawan ka because napakabura mo daw, something like that. Right? So, the consciousness change very quickly. Just what I exampled earlier na habang nakikinig ka ng video, nandiyan nanay mo, bigla ka sa bibilyawan, at hindi ka na doon nakatuon dun sa sinasabi ko ngayon sa video na to. So sabi nga, consciousness is about awareness of one's surrounding. Second would be, still much of what we do does not require deliberate. So meaning to say, example would be you are listening a music, okay? Like, Today My Life Begins. Okay, so you favorite that kind of song, like I will break these chains that binds me, happiness will find me, today my life begins. However, this kind of song, it has something to do in line to your memory because maybe this song you use as a graduation piece when you were in senior high, di ba? And that kind of song bring back you to the graduation. And meaning to say, does not require deliberate. Even that you are focusing on the song, since that you have a memory regarding on the song, nagbabago yung consciousness mo na pakikinig dun sa kanta na yon, and naibibigay mo ngayon yung memory mo dun sa kanta na yon. So it does not require deliberate. So hindi siya basta lang na kanta na focus lang dapat ako sa kanta without any recognizing, memorizing, or bring back all the memories that I have on my mind regarding on that song, di ba? Na-apply natin kung ano yung meaning ng kanta based on ourselves. Okay? Hindi mo pwede sabihin na, hoy, consciousness, dito ka lang makinig sa kanta at huwag ka makinig dyan sa isang experience mo. You can't do that one. And next would be, consciousness is required for any mental processes that involve imagining situations such as planning for future behavior. Halimbawa, I really want to take psychology course because I really wanted to be like a psychologist. Diba? You're imagining your future depending on what you are right now, the mental processes that you have right now. Okay? And that's what consciousness. Nilalagay niya tayo sa kabilang mundo na kung saan nagpo-foresee natin kung ano yung magiging buhay natin. We would like to become a psychiatrist, an RPM, or other related courses. Or maybe you would like to pursue to become a psychiatrist or cognitive neurologist, something like that. Okay, so yun yung ginagawa ni consciousness. Dinadala niya tayo sa kabilang ibayo ng life natin. And that is all about consciousness. Okay? So, there are lots of theories regarding on consciousness, but I only pick two consciousness or theory about consciousness. The first one is according to Bars, 1997. So, example of this one would be consciousness is a place where we temporarily attend to information at a hand of being important. Example, meron kang iba't ibang klase ng gamit on your table. Okay, meron kang andyan yung cellphone mo, gadget mo, laptop mo, iPad mo, or andyan dyan yung ballpen mo, lapis mo, and anything, or materials. So, ang consciousness daw, according kay Bars, ay parang may nakatuon dyan na spotlight. Okay? So, nakalatag dyan lahat ng gagawin mo, pagkatapos may isang spotlight dyan na, okay, nandito nakafocus ngayon yung information na to, okay? Na-spotlightan niya yung lapis, okay? Na-spotlightan niya yung cellphone mo. So, what you're going to do is to pick the cellphone of yours. Kasi, nakatuon lang daw si consciousness kung saan nakatapat ang spotlight na yun. And I hope I explained that one clear. And after you pick your cellphone, what you're going to do is maybe you text someone, okay? So, doon ka ngayon magpo-focus, depending kung saan nakatutok ang spotlight na yon sa table mo, okay? And next would be allows you to know what you are working with, feeling and thinking, Joe. So, that's what I explained earlier that consciousness allow us to mararamdam natin, anong iisipin natin, at ano ang gagawin natin. Just like my example, if you would like to, ang spotlight na yun ay nandoon sa table mo at doon nakatuon ang cellphone na yun, edi doon ka mag-focus na gagawin mo, iisipin mo kung paano mo gagawin at ano mararamdaman mo. Next would be consciousness awareness occurs in neurons. So, from many distinct regions work together. Okay, so imagine that you see an apple. Okay, before I go on this phase, okay, here's the thing. We know that the neurons send signal to the other neurons for them to be able to communicate to each other, right? So, para mangyari yun, ay si neuron 1, sabi niya kay neuron 2 na, uy, neuron 2, kunin mo naman itong information na to na perceive ko. Okay? So, it's a work hand in hand para makarating ito sa mental processes natin, yung consciousness na yun. Kasi, nag-work hand in hand ang mga neurons natin. Okay? So, imagine, example would be, may papakita ako sa yung mansanas. Okay? Nakaready na dyan yung consciousness mo, o yung mga neurons mo that is aligned for consciousness. Okay? Nakaready na yan. Pag pinakita ko sa yung mansanas, you will notice that i-explain mo sa, okay, yung mansanas na yung kulay pula, yung mansanas na yun ay round. Okay? So, nabivisual mo siya depending on sa nasasagap mong signal. Okay? So, it's working hand in hand by each neurons. And also, how does the brain come to inform us that we have experience? Sabi ko kanina, ang consciousness allow us to imagine the future behavior, or imagining something that is what we want or we don't really want. It's more about imagining. However, this consciousness also involves of recalling the past experience. Okay, sinabi ko din kanina na pala na bring back memories, bring back. Halimbawa niyan. After this pandemic, maybe kami nga kay Sir Jello, gumagawa siya ng video kahit ang pangit-pangit ang boses niya, di ba? So, you are trying to recall that thing based on your consciousness na nasagap mo that time na habang nagre-record si Sir Jello. Or it might be, nire-recall mo yung something at nilalagyan mo siya ng consciousness, inaalala mo yung bagay na yon. So, that is how consciousness works also. It's not always about seeing your future or imagining future. It's also about recalling something back to the past. All right. And there are two dimensions of consciousness. We have wakefulness and we have awareness. So when we say wakefulness, it is a degree of awareness reflecting whether a person is awake or asleep. Halimbawa nito ay wakefulness, ito yung gising ka, degree of alertness. Okay? So when we say awareness, monitoring information from environment and from own thoughts. So this will be an example. A person can be awake, pwede siya maging gising, but not very aware. as is true in vegetative state. So we're going to talk about also what is vegetative states on the next slide. It is same with this one, severe drunkenness. Diba, pag lasing tayo or nakainom tayo, we are awake, but we are not aware. That's why ang daming nababangga or nasasagaan kapag sila lasing. It's because of they are not aware on what they're doing, however, they are awake. Okay? So, ganun yun. Example would be also for wakefulness is in line 2, nandudoon ka sa isang scenario, however, tulala ko or sabaw moments, di ba? Yung mga sabaw moments or lutang moments, tawagin natin sa wikang Tagalog para mas maintindihan natin. These are things na gising ka, however, hindi mo alam kung you are not fully aware with your surroundings. Okay, so that is the two dimension. That are the two dimension of consciousness. Next will be this consciousness has level. Okay? Number 1 level is minimal consciousness. Minimal consciousness is an example of coma, a state of consciousness in which the eyes are closed and the person is unresponsive and unarousable. These people who is in coma, they're not able to open their eyes or move their body, right? However, they're gising. Gising ang consciousness nila. Kaya nga sabi, usapin mo lang yung tao na comatose kasi naririnig ganyan. And that is true. However, there has something to do with the reticular activating system or the RAS. Okay? So, what is the RAS responsible for? This is for sleep responsible. Okay? May mali kasi dun sa RAS nila. Kaya they're not able to make their eyes open or make their body move. Okay, however, they are conscious. So, comatose people whose brains show normal sleep pattern are more likely to regain consciousness than are those who do not exhibit this kind of pattern. Okay, next would be vegetative states. So, what is now the vegetative states? A state minimal consciousness in which the eyes might be open, but the person is otherwise unresponsive. Okay, vegetative state. So, how is this different from earlier? So, kung ang coma state ay gising, sarada mata mo, pero may fully conscious ka, kay vegetative states ay a state of minimal consciousness lang, in which eyes open. Open yung mata mo, but the person is otherwise unresponsive. Yung bang parang tulalay, hindi mo alam kung pag kinakausap ka, is hindi mo naiintindihan, hindi mo naririnig, and that is the state of vegetative. And wakefulness without activity. So that's the vegetative also, the definition of the vegetative state. Yung wakefulness ka without activity. Sabihin na natin na ito yung parang na-traumatize, di ba? Kapag kakausap mo yung tao is minsan nakatulad lang sila. However, their eyes are open. Okay? That is vegetative state. I'm not going to talk about this. You may read that one on your handouts. Next would be minimal consciousness. It is the state in which patients show signs of intentional behavior such as visually tracking a person but cannot communicate. So, for this, people who are minimally conscious often open their eyes but show very little behavioral response to the world around them. Okay? So, open yung eyes nila, pero may response, kaso minimal nga lang. So, ano pinagkaiba nito kay vegetative state? Sa vegetative person, cannot intentionally track person with their eyes. A minimally consciousness person can. So, that is the difference between vegetative state and minimal consciousness. And we also have tip of the tongue phenomenon. So, according to Galen 1994, we know a person's name and we know it, but we cannot come up with it. Limbawa nito is the example of, let's go to a Filipino so that we could, in the Tagalog sense, so that we could understand more. Kay tip of tongue phenomenon, ito yung, basahin mo ngayon dito sa dulo ng dila ko, pero hindi mo siya maidala doon sa conscious level mo, kaya hindi mo siya masabi ng buo. Kung babalikan natin si theory sa personality ni TOP, ang mangyayari nito ay lahat na nakikita natin sa surroundings natin or bagong pumunta sa consciousness natin ay isang bagay, dadaan muna yun sa pre-conscious. Kaya meron tayong unconscious, sabi ni Freud, pre-conscious and consciousness. Lahat ng unconscious, ibig sabihin you're not aware. Okay? Kapag sinabi mong pre-conscious, eto lahat ng information mo, such as the tip of the tongue, na kailangan madala mo sa consciousness for you to be able to execute it better. Okay? So, that is the same with the tip of the tongue. Na, you know what you're about to say, however, you're not able to speak that, or not able to say that one. Kasi nga, hindi siya fully aware na nandoon siya sa consciousness mo. Okay? And next would be, when we sleep and dream, we are moderately conscious. So, ibig sabihin nun, when we sleep, moderately conscious, how does that mean? Some of us know na kapag tayo natutulog ay ang nangyayari ay nakakapagpahinga yung utak natin. Yeah, that's true. However, we're still conscious. Kaya nga, there are times na halimbawa, sa panaginip mo ay, let's go back dun sa kanta ni Nawap, okay? Make it drop, something like that. No, I forget the lyrics about that one. Maybe, oh my God, nandito siya sa pre-conscious ko, hindi ko siya madala sa consciousness ko. Oh, that's an example. Okay, let me just remind that kind of thing so that I can give that one as an example. Okay. I forgot. Really, I forgot. Di ko siya madala sa consciousness ko. Okay, dito na lang sa Today My Life Begins Again. Halimbawa, itong Today My Life Begins na kanta ni Bruno Mars, kung di ako nagkakamali kay Bruno Mars yun, ay nasa state yun na this song is really memorable to you because this song was used as your graduation piece when you were in senior high. Okay? So, habang pinapatugtog yun, ay dahil sa moderately aware ka, nadadala mo ngayon itong kanta na to dun sa panaginip mo at napapaginipan mo yung something associated with that kind of song. With this, Today My Life Begins. Maybe siguro dahil sa pinatugtog yun, habang natutulog ka, na naginip ka ngayon ng nasa graduation ka or umiiyak ka or kung ganun may impact sa'yo at doon mo siya ma-associate. So, that is the example. Another example would be, bakit may mga taong umiipagtulog tapos sasabi na, ay, akala ko nasa CR ako. Yung pala, nandito ako sa kama, then magigising ka na lang, basa na pala yung higaan mo. So, that is the example, the external factor or the internal factor that is happening to you since that you are moderately conscious, like, naiihi ka, tapos, dahil sa naiihi ka, napapaginipan mo na nasa CR ka and then mapapaihi ka dun sa kama mo at masasabi mo, ala, kinabukasan, bakit basa itong kama ko? Yun pala kasi na naginip ka na nandudong ka sa CR. So, meaning to say, hindi pala totoo yung pag napaginipan ka ng isang tao ay iniisip ka nila. It's because of it has something to do with the consciousness. Lahat ng mga bagay na yun ay nasa pre-conscious level ng mind mo at nadadali yun sa consciousness. So, let it stop na yung mga in psychology says na kapag napaginipan ka ng tao, ibig sabihin nun ay iniisip ka niya, hindi yung totoo or napapaginipan ka din niya. It's a matter of na idadala mo since na moderately conscious ka habang ikay tulog, nadadala mo yung ganong idea at dahil sa yun lang yung time na kung saan free yung mind mo at maisagap lahat ng mga nasa pre-conscious mo, nadadala mo ngayon siya into consciousness level mo at napapaginipan mo. Example of that one also, in line to dream. Maybe it's not in line to this one, pero what about yung mga tao na hindi mo naman talaga kilala, pero napapaginipan, masasabi ko, bakit may napapaginipan ako mukha, pero hindi ko naman ito nakikita. It might be napaginipan mo, it might be nakita mo na siya, however, yung attention mo is hindi nakafocus sa kanya. And since na nakita mo ito at nakalagay lang siya sa pre-conscious mo at hindi mo siya nalagay sa consciousness level mo, and line to attention, kaya mo siya napapaginipan. Kasi, yung time na yun is moderately conscious ka at lahat ng mga information na to ay nai-imbak sa panaginip, yung nailalabas sa consciousness mo while you are sleeping. And we're going to talk about more regarding to attention later. Next, this one is moderate consciousness. This one is moderate consciousness. This one is minimal. Okay, that is the stage. Sorry, I forgot to add the moderate here and also here. Now, let's move to full conscious. When we say full conscious, ito yung flow. Example neto is this. You're taking an exam, okay? Sa unang exam ay sabi mo, oh, okay, mahaba pa naman yung oras. So, babagalin mo magbasa, di ba? And then, while sinabi ng teacher mo, habang ikaw yung nag-take ng exam, 1 minute, 3 minutes, 5 minutes left, blah, 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 5, 4, 3, 2, 1. Bumibilis ka ngayon magbasa. So, meaning to say, cramming is the best deadline? Yes, it is. It's because of flow. You are fully conscious. Conscious ka na ginagawa mo yung bagay na yun. However, bumibilis ka pa habang ginagawa mo yung bagay na yun because of flow. Another example for that one is like marathon. Halimbawa, tumatakbo ako sa isang field. Tapos, nagpapaunahan tayong dalawa. Kung tumatakbo ka din, ay sa palagay ko ako na yung mananalo. Okay? So, what I'm going to do, same speed lang itinatakbo from the beginning, from the middle until the end. However, napansin mo, konti na lang oras, matatalo ako ni Sir Jello habang ako tumatakbo dito sa field. So, ang gagawin mo, mas bibilisan mo pa. You are aware na tumatakbo ka. However, mas bibilisan mo pa. Magkakaroon ka pa ng ability to rise yung drive na yun into challenging task. Like, dahil sa ayaw mong matalo, mas bumibilis ka pa dun sa takbo. Diba? Mas bumibilis ka pa dun sa karera na itinatakbo mo. Kaya, maaaring maungusan mo kasi ganung bagay na yun. Another thing would be na mindfulness. So, mindfulness is a heightened awareness of a present moment, whether of events in one's environment or in one's own mind. So, mindful ka. If you are listening right now and then napapansin mo na parang tumitilaki manok, sumisigaw yung nanay ko na inutusan ako, nagre-reklamo sa akin kasi tamad-tamad ko na, and yung barking ng aso. Kung lahat ng yung napapansin mo while you are listening this recording of consciousness, you are fully you have a mindfulness regarding to that one because you are aware at the present moment. So that is the difference between two, the flow and the mindfulness. Next would be, let's go now to attention. So it is the limited capacity to process information that is under consciousness. So anong sinasabi nito? Pag sinabi natin limited sa attention, hindi lahat ng sinasabi ko dito ay naiintindihan mo. It's because of kung kanina meron tayong consciousness na sinasabi and we are trying to apply the things depending doon sa kung mali naman sinasabi ito Sir Jello, ibig sabihin yung full awareness mo or full consciousness mo ay hindi lang siya na doon kasi sabi natin the consciousness change very quickly. You are applying your thoughts on that consciousness that is happening to you right now. So, in line to this attention, it is a limited capacity. Well, according to science, only 10% of the information that you are getting from the instructor while he is or she is speaking is just 10% lang ng brain mo yung na-use doon. Okay? It's because of yung mga ideas na sinasabi ng instructor mo, nag-relate sa information mo, nadadagdagan siya ng mga information ngayon na sinasabi mo parang di matama yun or parang tama naman yun. That is now the attention. It is limited capacity. So, if that is limited capacity, it is better to read yourself also, not just by only listening. So that is why I am always encouraging to read your modules and handouts so that for you to be able to learn more. Next, there are lots of kinds of attention. We also have selective attention. When we say selective attention, it's the ability to focus on awareness, specific lecture features in the environment while ignoring others. So, we already tackled this one sa mga previous lesson natin. When you say selective attention, nakafocus ka lang din sa isang bagay. Halimbawa, ganito, may mga kapitbahay ka nagchichismisan. Tapos sabi, uy, alam mo ba, si Nena nabuntis. Tapos si Nena ay hindi na natuloy yung pag-aaral. So nagdating sa utak mo at gusto mo paniwalaan yung selective attention na yun ay si Nena ay hindi na nabuntis at hindi natuloy sa pag-aaral. But hindi mo sinala or kinuha yung information na pero after niya manganak, nag-aral ulit siya at gumanda na ang buhay. Halimbawa, ganun yung statement na nangyari. But dahil sa ginagawa mo is selective attention lang, nakukuha mo lang yung phrase o yung word that is na gugustuhan mo, that you are fully aware. Kaya minsan nagkakamali-mali tayo ng mga tanggap ng mga balita or pagsabi ng balita. It's because of we are doing selective attention depending to sa mga stimulus na nangyayari sa atin or stimulus na nakikita natin. And another part of selective attention to support this study, we have dichotic listening task. So dichotic listening task, example, you are wearing a headset now or earphone. Okay? So, sa kabilang earphone mo, ang pinag-usapan doon ay theories of personality sa left. Sa right mo naman ay statistics. Kaso, sinabihan ka dito sa experiment na to na, uy, mag-listen ka lang din sa statistic ha. I-ignore mo si theories of personality. So, according to the study, nare-record better daw ng tao yung information, even that may naririnig siyang dalawang type of voice. Okay? At nare-recall niya din maayos yon. Another example is this. Kung maalala niyo sa Party Pilipinas or SOP, okay? So, or maalala niyo sa, pag may mga kumakantang mga artista sa TV, tapos dalawa sila, di ba? May parang dual kind of song. Halimbawa, yung isa kumakanta ng dadaling kita sa aking palasyo, dadaling ng galang, ito yung tapos isa naman tuwing umuulan. Tapos dalawang singer na to ay nagpapasabay ng boses, pero how is that supposed to work? And nangyayari na, bakit hindi sila nalilito dun sa lyrics na sinasabi nila? It's because of that experiment of a dichotic listening task that align doon yung selective attention. Kahit may narinig silang background music, dahil sa selective attention, mas pinakikinggan nila yung boses na lumalabas sa bibig nila at nasa tono pa rin sila kahit na sila ay kumakanta. So that is an example also of selective attention. They don't mind what is happening around them. So ang mahalaga ay ma-execute nila ng tama yung kanta at gumagamit sila ng selective attention sa ganong klase. Okay? Hope that I explained that research very clear. Next would be, we have cocktail party effect. Napasadahan na din natin to sa mga previous lesson natin. Sa lesson number 1, I guess. Okay, ano nangyari dito sa cocktail party effect? Sa cocktail party effect, ito ang halimbawa. Sa isang bar, nandoon ka sa loob ng bar, may mga music, may maraming nag-chit-chat or maraming nagsasalita. Tapos, kausap mo pa yung lasing na mama na nakikipagkilala sa'yo. Paano nangyari yun? Na ang dami-daming loud music, tapos you are still focusing dun sa sinasabi ng tao na kausap mong lasing. At naiintindihan mo pa rin kahit na medyo hindi na maayos or straight siya magsalita. It's because of the selective attention. And under selective attention, we have cocktail party effect. That is the example. Another thing would be inattentional blindness. Nasabi na din natin to dun sa, or nasabi ko na pala to sa dati kong video. Nasabi ko doon, selective inattentional blindness is an example of selective attention. Meaning na ito ay dun sa gorilla experiment, di ba? Sinabi niya na kung ilang beses ipapasa ng tao neto or nakaputing tao ang ball, you're about what you did on that experiment. Na-count nyo yung number of balls kung ilan ipinasa. Pero hindi nyo na, dahil sa na-instruct kayo kung na ganito ang gawin nyo, okay, hindi mo nakita ngayon yung mga na may dumaan na gorilla kasi nga, you are focusing on something. You're only focused to the things na kung anong instructs sa'yo. Okay, so that is an example of selective attention under inattentional blindness. Next would be perceptual load model. So, states that we do not notice potential distractors when primary task consumes all of the attentional capacity. Example is this. Kapag break ngayon ng girlfriend or boyfriend mo sa gitna ng kalsada, well, napakamalas naman kasi sa gitna pa ng kalsada at ikaw yung tumatawid naman doon sa pedestrian lane. However, dahil sa doon siya nakapag-break, at sinabi niya, bakit ka nakapag-break? Kasi baka nanginginig mo, something like that. And nasasayin naman yung maniniwala or hindi. Pero in that sense, sabi mo, hindi naman totoo yun eh. So, ang ginagawa mo, nagre-reply ka and you're not fully aware with your surrounding kasi you are only focusing on what you are doing. So, ang nangyari sa iyo, ayun, nataygi ka kasi nga, nasagasaan ka kasi hindi mo na-notice yung mga distractor na to like jeepney, buses, tricycle, or motorcycle na padaan. So, that is an example of perceptual load model. You are fully loaded with what you're doing. That is why hindi mo na-notice yung mga paparating na mga distractors surrounds you. An example of selective attention also. Kung simula kanina hanggang ngayon ay nasustain mo lahat ng mga lahat ng mga information sinabi ko at naiintindihan mo, well, congrats to you. That is why you sustained the attention. And that is the next one. Sustained attention, how it works, it's this. Remember Peppa Pig? Si Peppa Pig, bakit nga ba 5 to 10 minutes lang, not 30 minutes to 1 hour? I guess, ganun yung movie. O hindi ba na sa umaabot sa matatagal yung mga napapanood ng mga bata? It's because of their sustained attention is limited. Okay? Kaya kailangan 5 minutes lang, 10 minutes lang, or 30 seconds na kailangan nilang panoorin for them to be able na maintindihan lang yung bagay na yon. Kasi kapag longer na, hindi na nila na-sustain yung attention nila, they get bored. Another example, when they get older, just like you, or adult, nasusustain nyo yung attention nyo dun sa nakikita at napaperceive nyo. And that's great. Nagagawa nyo manood ng K-drama na 2 hours, okay, or mas longer pa, di ba? Kasi nga, nami-maintain nyo yung focus and awareness nyo dun sa target idea na gusto nyo makita or dun sa nakikita nyo. So, ganun pala yun. Kaya pala, when you try to search the Baba Black Sheep song, diba, like, maybe ako lang ata nakakalinis because of my age, like, Baba Black Sheep, have you any wool? Yes sir, 3 bags full, something like that. And doon sa video na yun, if you're going to search, yung sheep or yung tupa doon na tinutukoy sa Baba Black Sheep ay nag-iiba ng kulay, naging pink, naging white, naging blue, naging green, naging gray. Bakit? Anong meron? Kasi ang mga tao na ininingkayat sa mga na manonood nito ay mga bata. And for them to be able to sustain the attention of them na para mapakinggan, maintindihan na maayos kung ano ang meaning ng kanta, kinakailangan nila ng activity para or something na kakaiba. Hindi lang siya paulit-ulit, hindi lang siya stagnant or iisa lang siya ng tema. Para masustain yung attention nila doon sa pinapanood nila at para ma-maintindihan din nila yung kanta. Another thing, hindi lamang lahat ng bata ay kaya mag-sustain ng attention or may iba na kayang or gusto mag-sustain ng attention pero hindi nila kaya ma-sustain yung attention. Example is ADHD, taang may ADHD or attention deficit hyperactivity disorder, okay? Sa ADHD kasi, gusto nila makinig, gusto nila ma-focus yung attention nila pero dahil sa may something wrong with the brain chemicals dun sa taong may ADHD, hindi nila nakakayang kahit na gustuhin man nila na matuon yung attention nila doon. Another example is in DSM or Diagnosis Statistical Manual, neurodevelopmental disorder. Yung mga taong may, halimbawa na lang, ganito, Down syndrome. Okay, sa mga Down syndrome people kasi, gusto naman talaga nila na makinig. Pero, hindi nila kaya na mag-focus doon sa pinapakinggan nila or nakikita nila. Kaya minsan, nag-change sila ng thought. Okay, hindi na sustain yung attention din sa nangyayari o ginagawa or matagalang pag-focus. Okay? Kasi there's something wrong with their neurons. Okay? Sa brain chemicals nila. That is why they're not they cannot focus themselves dun or masustain yung attention na yun. Okay? I hope I explained that one clear also. Next, multitasking. So, I'm going to summarize na lang this everything. So, sustained attention is compromised during multitasking. The evidence suggests that truly concurrent or parallel task performance rarely occur. Instead, what we consider multitasking really involves fast switching. So, there is no such word as multitasking. Sabi kanina, ang attention daw can only focus on, we have bars, di ba? Kanina, dun sa workspace. Okay? Ibig sabihin nun, kaya mo lang daw makapagtuon dun sa isang bagay at hindi mo kaya na lahat yung pagsapa-sabayin. And that is true according to experiment. Okay? Na hindi kaya ng tao mag-multitask. They can't do something perfectly with walang pagkakamali. So, our brain only switch. So, there is no such word as multitasking, lalo na sa cognitive psychology. Okay? And that is also multitasking is much more likely in exercise and rapid switching between tasks rather than actual performance of two at the same time. Okay? So, switching ang nangyayari doon. Another thing, let's go to meditation training and the brain. So, meditation changes brain function and structure. So, kung more likely ka na meditate, ay mas, ano nangyayari? Kumakapal yung myelin sheath mo. So, para saan ang myelin sheath natin? Nasabi ko na yun dati. Okay? After 8 weeks of mindfulness meditation training, people with no previous meditation experience showed significant increase of EEG activity in the left frontal cortex. So, that is good daw ang meditation para sa training ng brain natin kasi napag-alaman na may significant increase daw doon sa frontal cortex natin while using this EEG. Okay? MRI scans revealed thicker tissue. This is what I was trying to say. Na in areas of the cortex associated with attention, sensitivity in the bodily sensation, and the processing of external sensory. Next, we go now to sleep and dreaming. So, though at time of rest, sleep in fact a very active process. Okay? The sleeping brain is very active but is only partially processing information from the outside world. Okay? Brain is very active. But is only partially processing information from the outside world. So, meaning to say, there is processing pa rin dun sa nangyayari sa'yo while you are sleeping. Two properties of sleep. Number one, it creates perceptual wall between the conscious mind and the outside world. And number two, the sleeping states can be reversed in an instant by waking. Sorry for the word, it is waking. Okay? So, yun daw yun. Yung properties ng sleep. So, hindi lang siya para magpahinga ka kaya ka natutulog. It's because of kailangan mo ng number one and number two. Perceptual wall between consciousness, mind, and the outside world and the sleeping state can be reversed in instant by waking. Another thing, sleep and circadian rhythms. So what is circadian rhythms? This is a variation of physiological processes that cycle with approximately 24-hour period. Okay? So, many psychological systems, including the sleep, wake cycle, feeding, hormone production, and cellular regeneration vary on circadian basis. Okay? So, the body has an internal timekeeper located in the hypothalamus called suprachiasmatic nucleus or SEN. When the retina in the eye sense the light in the morning, it stimulates the SCN, which in turn signals the nearby pineal gland to decrease the amount of melatonin it releases. So, meaning to say, circadian rhythm is important for us or sleep is important for us because sa ganitong paraan lang tayo nagre-regenerate ng hormones and cells and other things related sa brain natin and into our body. So, according to study, kailangan tulog ang tao by 10 to 2 p.m. only kasi that is only the time lang nagre-regenerate ang cells mo. Depending on that is in accordance to circadian rhythm. It's because of the phasing of the sun. Okay? So, dapat 10 to 2 tulog ka na para mag-regenerate kayo ng hormones mo. Okay? And the sleeping brain. In 1915, Nathan Kittman and Eugene Aserinsky were studying attention in the children and noticed that the children lost attention and fall asleep. Their eyes move rapidly underneath their eyelids. So, that is what we call REM. Rapid eye movements. Okay? So ano ba itong REM na to? Ang REM na to is a quick movement of the eye that occur during sleep, thought to mark phases of dreaming. Okay? Thought to mark phases of dreaming. So that is what we call REM. So, quick movements of eye that occur during sleeps. Okay? So, ibig sabihin ng REM ay phases of dreaming. Ibig sabihin na nanaginip ka when there is a movement of your eyelid. Okay? So, function sleep. And there's a lot of study related to rapid eye movement also. Okay? Maybe you would like to search that one also. Sabi nga natin, it's only 10% lang ng brain natin ang nagagamit natin kapag tayo ay nakikinig. So, you have to study also. Okay? Next would be, ano ba function ng sleep? Sleep deprivation. So, this is in line also. Inhibits the growth of neurons and impairs production and chemicals that make up the myelin sheath, which is crucial for the smooth and rapid conduction of neural impulses. Okay? Inhibits the growth neurons. Okay? So, hindi lumalaki yung, it inhibits the growth, okay, of neurons kapag nagkakaroon ka ng sleep deprivation. So, sleep deprivation also talks about napping improves memory for language even. Okay? So, it's better na not to deprive yourself kung maaari ay magkaroon ka ng kakaunting nap. for memory, for language even. And it is interesting that growth with language learning challenges children with dyslexia often have disturbed sleep pattern. Okay? We also have sleep depth. So, sabi dito, kung kulang ka sa tulog ngayong araw ng 2 hours, dapat ibigay mo yung tulog na or i-add mo sa mga susunod na araw o sa mga susunod na um, kinabukasan. Okay? So, ang ideal would be 6 to 7 hours na tulog. Kung yun ang ideal na 6 to 7 hours na tulog, depending on your age, ay dapat, kung nakatulog ka ngayon ng 4 hours lang at ang ideal sa ganyang age mo ay 6 hours, may utang ka pang dalawa. At yung dalawa na yan ay dapat ibinibigay mo sa mga sumusunod na araw. Okay, that is what we call sleep debt. Most people don't pay back their sleep debt. Oh, so sad. So they pay in the other ways. So what they do? What they do is to use stimulants, okay, such as caffeine or nicotine. A lack of focus, attention, and impaired learning and memory. So they tend to smoke or they tend to drink coffee just to compensate lang yung sleep debt na yun. That's what other people do. Okay? We also have disorders of sleep, and that is number 1 is insomnia. Sleep difficulty characters by difficulty falling and staying asleep as well, not feeling rested. Okay? So, nagbibigay tayo ng Ambien para umapekto sa gamma-aminobutyric acid natin or GABA. Okay, so that is the drug treatment na ibinibigay sa taong may insomnia. Next, narcolepsy. This is for sa mga tao na may sleep disorder na nakakatulog na lang sila basta-basta. So, what is the treatment for this? Ay amphetamines yung binibigay as a stimulant. We have to go now for dreaming. Okay? Dreams are images, thoughts, and feelings experienced during sleep. Okay, that is the definition. So, in accordance psychoanalytic interpretation, dreams are the royal road to the unconscious according to Freud 1990. So, royal road to unconscious. Okay, dito natin, I think this is the example as what I was saying earlier. Okay, next, manifest level. Okay, Freud surface level of dreams recalled upon waking. So, in manifest level of dreaming, these are the things na nare-recall mo not after mo matulog. Okay? Naalala ko, ganito panaginip ko, something like that. With that kind of thing, that is what we call manifest level. And we also have latent level. Freud's deeper unconscious level of dreams, their meaning is found at this level. And yung bawa sa latent level ay nanaginip ka ng isang elongated object. Halimbawa, nanaginip ka ng puno. Kung i-interpret ni Freud yan, that will be a genital, male genital. Kaya siya puno ang naging panaginip ko. And there is an unconscious meaning behind that one. Next would be, with this one, we also have psychoactive drugs, naturally occurring or synthesized substance that when ingested or otherwise taken into the body, reliably produce quality changes in conscious experience. And for tolerance, the need to consume increasing amounts of a drug to get the desired effect, and withdrawal symptoms, the adverse effect people with a physical dependence experiencing if they stop using a drug. Okay, so for this, withdrawal symptoms, ito yung mga na-experience ng tao na nakadepende na sila sa mga narcotic and narcotic drug at saka caffeine, narcotics, yung mga mag-istapagyosi, there will be withdrawal symptoms. Okay? And that's it. Next would be hallucination. So, convincing sensory experience that occur in the absence of external stimulus. So, hallucination. People with schizophrenia having hallucination. So, what is this hallucination? Hallucination is a convincing sensory experiences that occur in the absence of external stimulus. Is like, may nakikita ka na hindi naman nakikita ng ibang tao. Okay? Palagay mo, lumulutang ang isang gamit, doon hindi naman talaga siya lumulutang. So that is an example of hallucination. And people with schizophrenia, they have this kind of aspect of hallucination. Next would be addiction, a condition that results from habitual use of physical and psychological dependence on a substance. So, in line dito sa addiction, ito yung mga tao na hindi na, when we say addict, it's not about of gusto mo yung ginagawa mo. Kaya mas napupurso ka na i-take yung bagay na halimbawa cigarettes. Gusto mo kailangan ng isang kahaka ng sigarilyo sa isang araw. It's not about that na pag sinabing 20 kahaka sa isang araw, 2 packs ka ng kahang sigarilyo sa isang araw ay does it mean na ayok na yung bibig mo para magsigarilyo? No, it's about of the level of the nicotine that you are trying to take lang sa tabako ay tumataas kasi yung level of expectancy ng iyong katawan. Kaya, or the tolerance ng nicotine sa iyong katawan, kaya mas dumadami kang mag-stock as time goes by. And that's what we call addiction. Dumadami, it's because of para sa iyo, wala na epekto yung nakakaisang stick ka lang, kaya kailangan 2 stick ka na bawat sigarilyo. Okay? Next would be, we have depressants. So, depressant is a substance that decrease or slow down central nervous system activity. So, depressant ang ibinibigay sa mga tao na gusto nilang mag-slow down nervous system activity nila. And in low doses, these drugs generally calm the body and mind. Sa high dose naman, they can slow down their heart rate and brain activity, generously low levels. It also increases the GABA activity, and alcohol can destroy the neurons of developing fetus. So, meaning to say, alcohol is a type of depressant also. And sa mga nagbubuntis na nag-iinom, kaya pinagbabawal ng alcohol once you are pregnant kasi nade-destroy neto ang neurons na meron dun sa bata, sa fetus. Okay? Combine the alcohol with sedatives. So, ano tong sedatives na to? And this is another drug, can be also lethal. So, alcohol mostly used depressant. Okay? And we also have to know the number of alcohol, something that we have in our blood. We have blood alcohol concentration or the BAC. This is the amount of alcohol in the bloodstream. So, what are the negatives of alcohol or the effect? Binge drinking. Binge drinking is usually defined as at least 5 drinks for men and 4 for women over 2-hour period. So, mild to moderate alcohol intake generally defined as no more than 2 drinks a day. Okay? So, that is the ideal lang dapat na tinitake ng isang tao. Kapag men, dapat ganito. Kapag women, ganito lang dapat. And it has an effect also to the body natin, lalo na kung ikaw ay buntis. We also have sedatives. And in sedative drug, there's a lot of kind of drug that is sedatives. And it is an antidepressant that creates feeling of support similar to that of alcohol intoxication. Okay? You may want to research what are the sedative drugs kasi hindi mo pwedeng i-combine si sedative at saka si alcohol. Dapat you have to know kung ano ang mga sedative drugs na kailangan na iniiwasan mo kapag ikaw ay nagtitake ng alcohol. Okay? Combining alcohol with sedatives can be lethal kasi nga nakakamatay siya. So, you have to know that one. That is why, ito mga sedative drugs, sometimes meron na ito sa mga party. Kaya, kapag kinukumbine nila, is namamatay yung tao. Okay? So, slow the heart rate, relax skeletal muscles, and tranquilize the mind. And also, barbiturates are used in anesthesia to calm people down. However, these barbiturates ay nasasamantala ng ibang tao. Okay? Because barbiturate is a kind of drug, is a kind of sedative drug also. Okay? So, we have opioids, or also known as narcotics. May be derived from natural sources, such as morphine, may be partly synthetic, just like heroin, or completely synthetic. Okay? So, may iba't ibang klase ng opioids or narcotics. Opioid depress central nervous system activity, slowing heart rate, respiration, and digestion, and suppressing the cough center. Opioids also, or the narcotics, also used as pain relievers. We have opium, morphine, and heroin produce a feeling of overwhelming bliss, euphoria, and the bodily relaxation. And I guess this is the last. We have hallucinogens. So, hallucinogens are substances that create distorted perception of reality ranging from mild to extreme. So, there are drugs that can produce hallucinogens, okay, such as marijuana. Okay, that is a type of drug that is aligned for hallucinogens also. Okay, here goes. We have marijuana, calm, sleep, and cannabis sativa plant. Okay, marijuana do? Marijuana can be used as in medication, but there are people uses marijuana just to wala lang. Okay? What are the side effects of marijuana? It alters the mood of the person that have euphoria and changes perception, especially one's perception of time and food. It also increase risk of lung cancer, may lead to schizophrenia, and endocannabinoids, natural marijuana-like substance produced by the body. Okay? So, sabi dito, alters mood to create euphoria and changes perception, especially one's perception of time and food. So, yung tumataas silang kumakain ng mas madami, I guess that is the effect. Ay, no. Yeah. Mas nagugutom sila when they have marijuana kasi it has something to do with the brain chemicals. Ano ba nakaka-apekto nito? Bakit mas nagugutom ang mata ng marijuana? Okay? And that is the end of lesson number 4. Hope you learned something. Expect the recording this week for lesson number 5. Thank you for listening and have a great day.